Okay, so now you brought a model with us, right?
Well, model and a patient.
And you said now
doctor.
if you want bigger results, then this is when you go see Dr. G. Okay, here we go. What is this now?
Now, if we want to do something by putting something, these are all dealing with artificial fillers and topicals. We want to use our own body. We can actually withdraw our own blood, get growth factors, and get serum from our blood and inject it back into the face.
Shut up. So now, what is your name?
Tatiana.
Tatiana, how are you? And you are?
I'm Dr. Power.
How are you? Oh, I won't touch you.
I apologize. Nice to meet you.
So we're going to show, Dr. Power is going to show you how to inject this, and basically you can come into the office, they draw some blood, spin it down, and then re-inject it into some fine lines.
Does that hurt, Tatiana?
Just a little prick.
Really? You don't feel it any more than that? You're lying.
You can
don't
also
talk.
numb it slightly. And secondly, by the way, this is something that lasts a long time. This is not an artificial filler that's going to dissolve.
Now
and
wait,
stimulate
so
your own
what
cells.
this is doing is it's stimulating her own cells
Correct.
to grow so the lines don't form?
What it is in our blood, like when you have a scab on when you scrape your knee, that little yellow stuff that comes out, is in it is platelets and growth factors that help your body heal. We're actually injecting that back in with the filler, and what that's going to do is...
Platelets and growth factors.
Right.
So
And
is
it's gonna
this
help-
expensive?
This probably will cost somewhere between $1,500 to $2,000, but it lasts for a long time. Remember, we're putting living tissue back in.
So literally, do the cells know what they're doing? I mean, are they smart enough to know not to form like massive lumps?
It's actually an interesting question. But this is not a stem cell, but this is a growth factor. So what it's going to do is stimulate anywhere where you have a slight injury or stimulate growth within the tissues themselves, but it won't promote.
So if the skin is dying, it will stimulate the skin to regenerate.
Correct. So if you were to do this, say, in combination with a facelift or a combination with fat grafting, you'll have a more effect because you have somewhere that is being stimulated by the growth factors themselves.
So see how one side, look at the difference, the lines here and the lines here.
There'll
That's
be an immediate effect.
Crazy. Immediate effect, huh?
And there'll be a long effect that lasts longer as the growth factors work. This is an immediate effect, and then there'll be a more long-term effect later on.
Dr. G, the best. Come on. For more information about Dr. Motykie, go to our show website. And thank you so much for being here. Oh, I guess I can shake your hand now. And thank you for being here, Tatiana, too. Seriously. We will be right back. Always on Marie. Interesting stuff.